Okay, so for this video, I will be giving a stretch, a strengthen, and a home care for a client that presents with a hyperlordosis. So what a hyperlordosis is an increase in the lumbar spine, which causes contraction of the hip flexors and weakening of the lower back muscles. So the stretch of choice for this is going to be a hip flexor stretch. So you're going to get down into a lunge position and on one knee and push forward, and you'll feel a stretch down the front of your leg. It'll look like this. So you push forward and you feel a stretch down the front of the leg that's on the ground. So the risks associated with that are might be painful on your knees. You might feel discomfort throughout your hip. If that's the case, definitely we can reassess it or make accommodations. But it's a stretch, so it should be a little bit uncomfortable. The goal is to lengthen your hip flexors because they are in a contracted position. And you're going to hold that stretch for 30 seconds, and then you will take a rest and do the other leg. So you rest for one leg is doing the other leg, and then repeat. So you're going to do 2 sets of that for twice a day for the next 3 to 4 weeks. And you want to go into the stretch slowly. Find a point of mild discomfort, hold that for 30 seconds, and slowly come out of the stretch again. And it's also important to remember to continue breathing while you're doing the stretch as well. The strengthening exercise is called a Superman. So what that's going to look like is I'm going to be laying prone on the floor, hands behind my bed, behind my back, and then just extend my back up like that. So bringing my chest off of the ground. So it'll look like this. The goal of that exercise is to target your erector spinae muscles, ideally in the lumbar spine. Those are the muscles that are stretched and lengthened when you have a hyperlordosis. So by strengthening those, it'll help reverse the spinal position and bring you back to a neutral pelvis. So for this, you want to do 3 sets of 12 to 15 if you can. If it's too challenging, definitely go less reps, but aim for 12. And when you get to the top, just hold for a second and then come back down. So you want to breathe. So exhale on the way up and inhale on the way down. Exhale, inhale. You're gonna do that for 3 to 4 weeks as well, and we'll reassess at the end of that. In between each set, take a minute rest, and just make sure when you're doing the movements that you are moving, like you're not moving fast. It's not a explosive movement, just slow. Get to the top, take a second, hold it there, and come back down towards the floor. And for the home care for this, you just want to ensure that when you're walking around, sitting in a car, doing your activities of daily living, you're just maintaining a neutral pelvis. So to do so, you just put your hands on your waist and just pull your pelvis anteriorly to try to counteract that hyperlordosis. And then in doing so, you just hold that and maintain that throughout the day, and just take mental checks through the days to make sure you are not forgetting to do that. And it will definitely help to improve the condition as well.